magandang umaga sa inyong lahat. Ako po si Fumiya. Welcome back. And Rabies with Fumiya. I'm sorry today. My voice is not good, pero I'm still foggy, so it's okay. Yeah. So, we have an excited video for you today. In this episode of And Rabies with Fumiya, we will know more about symptoms of rabies in humans. Dr. Tim and I have a special guest for you today. Dr. Tim, can you introduce our special guest?
Magandang umaga sa lahat. That's right, Fumiya. We have a special guest for today's episode. We will be joined by one of our RITM's experts on rabies, Dr. Beatriz Quiambao. Dr. Betty is a Pediatric Infectious Disease Specialist and a clinical researcher with special interest in rabies. She is one of the foremost experts on rabies in the Philippines and has been conducting rabies research since 1992.
It is great to have you here with us in the show, Dr. Betty. We are looking forward to this show, and I'm sure we will learn a lot from you today. Hi!
Hi, Fumiya. Hi, Tim.
Hello
And
po!
to all your viewers, good morning. It's nice to be here in your show. And I'm very glad and I would like to thank you for doing this rabies education campaign with us.
Hey, thank you so much. Welcome, Dr. Betty. I'm thrilled doing this project and I wanted to learn more about rabies as well. I know that this is still a problem in the Philippines and I want to help Filipinos finally get rid of rabies.
We really want to eradicate rabies in the Philippines.
Mm.
And if we engage the public, that is one of the best ways to do it.
So, for today, I want to ask you more about rabies symptoms, particularly how rabies affected humans when it gets worse. Dr. Tim, I know you have video for us to show, diba?
Yes, Fumiya, we have some videos to show you. So these videos are documentation on the symptoms of rabies on humans. These were shot by Dr. Steve Sholand at the San Lazaro Hospital. I think this is the first time you would be seeing them.
Yes, I've never seen that.
Okay, so this is a boy admitted
Yeah.
at San Lazaro Hospital.
Mm-hmm.
And this is already a bit late into the illness, and you'll see further on in the video that the boy is very restless
Yeah.
and he's agitated, and usually they are very dehydrated. They lack water because they're not drinking. And you see here his agitation. He covers himself. He's afraid of water. He is also afraid of air.
Air?
Yeah, so that's part of the symptoms of rabies.
Wow.
So there you see him moving restlessly, his feet, his arms, and then again trying to cover his face.
Wow. This is my first time to see like this.
It's very sad seeing kids affected by rabies.
So this is the same child, and here we are trying to show what we call hydrophobia. So if you see, the mother is holding a cup of water and is trying to ask the child to drink, and you'll see that he really does not want to drink. He avoids, covers his mouth, even if the mother is already trying to push him to drink the water. He does not want to drink it at all. And he's very agitated, trying to get away from that plastic cup of water. You see more agitation there. Again, the mother is trying to offer the child a glass of water. And you see him is trying to really move away, moving to the head of the bed so that he can get away from that glass of water. Now, why is he doing that? Because in rabies, when you drink water or you even see a glass of water, it will cause some involuntary contraction of your throat muscles. So it's very painful. So the patients try to avoid that as much as possible. You just see a glass of water and then you have contractions on your throat. Very painful.
Just see?
Yes, just see.
Wow.
Just see. And it's also the same if you are exposed to air. Let's say you fan yourself. Also the same contraction, painful contraction. So they don't like air.
Is it same as dog? Dog also they tackle water.
Yes. And actually they're not able to drink.
Wow. I know about it's afraid of water, pero I didn't see the video like this reaction. That's why medyo shocking talaga.
It's a very sad reality for all rabies patients. And usually those symptoms are towards the end. Usually death will come maybe the next day or 2 days after.
2 days after.
Very fast. When the patients have those symptoms already, the ones that we see in the video, it means the rabies virus is already in the brain. So from the brain, so it spreads to the rest of the body.
Okay.
So let's say you are bitten on your leg, the virus is on your leg, and then it travels to your brain. Once it is in your brain, that's when you start to have those symptoms. And then after that, it's very fast.
So if we can see that reaction, like afraid of water, it means
Rabies.
Yeah.
Yes. And it means the patient is going to die.
Wow, it's so sad talaga.
And what's sad is that 40% of people who are bitten by rabid dogs are children less than 18 years of age. So a lot of the patients are children.
It is certainly sad that a lot of rabies victims are children. I think it makes the problem of rabies more urgent.
I agree. Rabies is a disease that we can eliminate. So I think we should work hard to do this in the Philippines.
Yes, so, and then that kanina, the video, they were taking about hydrophobia and fear of water, di ba? How does this happen? Does this appear immediately after being bitten?
No. After being bitten, there's about 1 to 3 months before the patient exhibits symptoms.
Okay.
Sometimes it can be as short as 5 days or sometimes as long as 2 years or longer. So it's very variable. Also depends on where the virus or where the patient was bitten. So if it's in the leg, so since it has to travel up to the brain, it takes a longer time. But let's say the bite is on the face, then the travel time to the brain is shorter. So the symptoms will come earlier.
So I think some people forget when they
Or
bitten,
bitten.
di ba? Kasi too long minsan, di ba?
Yeah.
Wow, I see. That must feel horrible for the patients. So patients with advanced rabies always show this?
No. There's another kind of, another type of rabies called paralytic or dumb rabies. That kind of rabies, there is no hydrophobia, there is no aerophobia. The patient is just paralyzed. So, yeah, there's 2 ways. No?
It must be scary for healthcare workers encountering this disease. How do you cope up when you have patients like this in RITM?
Well, we see a lot of rabies patients at RITM. We used to see about 2 or 3 per month. But now, in the past few months, we've been seeing as much as 4 to 5 per month. So there's an increasing number of patients being admitted here for rabies. It is actually very sad to see them die right in front of you because you know that you cannot do anything. But we try not to think of that. We just provide them the best care that we can give them. We call it comfort care because there's really no medicine that will cure them. So we show respect for their privacy, for their dignity, and for their cultural needs because sometimes they have different cultures. And of course, we talk to the relatives to tell them what to expect, and we pray for them because that's about all we can do.
This is amazing the strength at lakas ng loob mga healthcare workers. It is great being able to work with you, Dr. Betty, Dr. Tim, and Dr. Nobu. And all these discussions are making me admire healthcare workers more. So to our viewers, please take care of yourself and take care of your dogs. And together we can eliminate rabies.
This is very true, Fumiya. I think everyone here in the Philippines is looking forward to a rabies-free Philippines. And to our viewers, please remember to go to your nearest animal bite treatment center in case you are bitten by a dog or a cat.
Thank you so much. Maraming salamat for today. I'm so good experience to see the video. Maraming salamat, Dr. Betty and Dr. Tim.
And
Rabies with
Fumiya.
I hope that this video will be shared with as many people as possible and that rabies will be eliminated from the Philippines. So please share this video with your friends.